Welcome to the JCIH podcast, Health and Communication Distilled, a podcast of the Journal of Communication in Healthcare, Strategies, Media, and Engagement in Global Health. Each 10-minute episode features conversations with our authors on translating their research findings into practical and policy recommendations that will ultimately improve patient, community, and population health outcomes.
Welcome to a new episode of the JCIH podcast, Health and Communication Distilled, a podcast series by the Journal of Communication in Healthcare, Strategy, Media, and Engagement in Global Health. My name is Nikita Boston Fisher, and I am the journal's Senior Editorial Assistant. Today we have with us Dr. Kadi Lubi, and we will be discussing the journal article, Other Patients Become a Secondary Priority: Perceptions of Estonian Frontline Healthcare Professionals on the Influence of COVID-19 on Health Inequality and Ethical Decision-Making, which we published online in December 2021. Hello, Dr. Lubi. Thank you so much for being here with us today. Could you please introduce yourself a little more to our listeners and also summarize your study in a few words?
Hello, and thank you for having me here. Yes, we were interested about ethical decision-making, or what kind of ethical burden frontline healthcare workers perceived during the first wave of COVID-19. And the interest just raised because many countries witnessed very difficult situations where there was a lack of resources, lack of medical resources, namely, and healthcare professionals had to make very tough choices to which patients to give some resources, either oxygen masks or any other kind of resources, and to which not. And we were interested about the situation in Estonia as well, because as a small country, we often have this kind of struggles in healthcare funding. And in this sense, Estonia was a very interesting case because we were lucky enough not to see this kind of very heavy start of the COVID-19 during the first wave. Actually, it was the situation where it was geographically very much isolated into one island, and it was easy to basically restrict the access to this island. So it was during first wave mainly kept in this one island, and just the physicians went to help and other healthcare professionals to this island, but the virus itself didn't spread so widely. And that's why we were also interested how this first period was seen through the eyes of frontline healthcare professionals.
Thank you for sharing that. In your paper, you talked about the 5 main factors that jeopardize and complicate health equity. Could you please share your thoughts on how COVID-19 impacted those factors?
Yes, based on the literature review, or what was known before, we were able to outline these 5 factors, and these were limited access to healthcare, the issue of ethical decision-making, also vaccination, social stigmatization, and also indirect influences such as economic slump or burden. And of course, if we are thinking about COVID-19, then the limited access of healthcare in this situation was mainly related to people who had any other conditions than COVID-19, because basically the whole healthcare system was paused, and people who had any chronic conditions, who had any other acute conditions except oncology patients, they were basically had to manage by themselves. And I think that this situation very clearly outlined that we already have big gaps, because we assume that when people are even long-term chronic patients, that they can manage their illness by themselves, they can use different kind of tools. And actually this situation highlighted that it is not so, that actually people still need to discuss with the doctors, that they don't know what will happen. Another group of patients are to be chronically ill patients, which means that if they had some conditions like pre-diabetes already, but let's say during the period, for whatever reasons, the illness progressed, they actually lacked the diagnosis or it was delayed. And that's why we just have to think about that. And sometimes what happens that when patient afterwards will go to the physician, the first question is, where were you so long? So we are like double shaming them, let's say, that first they were limited access, but of course, due to the delay in diagnosis, they also might have worse health condition afterward. It is really challenging. Then when we're talking about this issue of ethical decision making, then usually healthcare professionals face those decisions in very drastic situations or end of life situations. They are trained to act under these circumstances. But now they had to manage those decisions in very big amounts because it was not only daily basis, but it was probably every hour they had to face that what will happen now. And this can also have very severe effect on healthcare professionals' mental burden or emotional burden. And at that time, of course, now we know about the virus more, but we have to keep in mind that at that time, basically each day the information changed about the virus and it was unknown what will happen to whom. So it was challenging. So how to work as a healthcare professional and at the same time be as human being as well. So this was definitely a very tough situation to any healthcare professionals who were on front line. If we're talking about vaccination, this is more in this global sense, and this is also something that we have witnessed, that the vaccine was quite quickly still available to developed countries. But people who are on middle or low income countries, they still didn't have so quick access, although there are more people and they might have needed the support and help to get these vaccines. So in worldwide or globally, the health inequity in this sense definitely also increased because of that reason. So I think social stigmatization is something that I can imagine that many people experienced in not only having COVID-19, but even in the situations where they were suspected to have it. Because especially on the first wave or this first spring in 3 years ago, people were afraid of that illness, which means that I think we haven't seen in decades this kind of illness where people are afraid to talk to somebody or touch them or do this kind of things. And also, as our doctors said, that when it was clear to their neighbors that they are working with these patients, they wanted to avoid them. And if we're thinking that they were isolated anyhow in their working conditions, they were isolated from their families to really keep it. And then when you know that all other people also see you as some kind of deviant, let's say in this way, and want to keep away from you, it will have this kind of effect on people's mental health as well, because we are still like social beings, and this is a very tough situation. And also people who were ill, I can imagine that if you feel already quite poor anyhow, and then you understand that, because this was the situation also what we observed during our study, that for example even nurses and some caretakers didn't want to go to these patients because they were afraid of. So you are isolated like in very severe way. You just feel that basically you are alone in the world, feeling poor, and that might have also impact the later outcome, because if you feel emotionally that there is no point anymore, also physics doesn't want to get well. And of course, and this is again similar to what we were finding in our study, that people said that, okay, after the illness, because during the first wave, also employers were asking that, okay, you can only come back after you will show me the COVID-19 negative test. Today, we know that it will not disappear from the blood, that it will remain there months. And these people just felt that, okay, it's still positive. They were not allowed to go back to their working environments, which after all meant that they were suffering economically as well. So a lot of different kind of impacts, not only on health, not only on mental health, but really socially, emotionally, financially.
Yes, those are very important findings. What implications would you like your research to have on policy and practice?
I think the main thing what we still discovered and what was the focus of the study was that maybe we still do not prepare our healthcare professional enough for this kind of situation where they have to face ethically challenging decisions. Because of course we teach how to talk to patients, how to talk to their relatives, but now it's just the extent of this event was so huge. And at some point, people really felt that they have to choose between their professional and personal ethics, maybe sometimes because institutionally there were some rules, but maybe personally they didn't think that it is justified. And this is something that we should think about how to teach this kind of thing, and also maybe kind of policy change also, that really how to support under this kind of crisis situation, because crisis is something that comes always unexpectedly. That's why it is crisis. If we would know this, it wouldn't be crisis, but we would expect it. And we could prepare for that, really to have this kind of simulations maybe more, not only on the stage where people are in university and studying, but also on regular practice. And maybe to really, and what was done in, at least in Estonia, and I believe that also in other countries, that hospitals started to do their own, this kind of instructions on what are the principles that because it is easier for people also to follow the instructions, although it might create a situation where these instructions somehow contradict to their own personal values. But as many of our participants still said, that working in healthcare is anyhow ethically challenging, and they are doing it even without the crisis. So that really, if to conclude what I have said now with many words, is that really the main recommendation is that to think about in terms of policy and practice on educational approach as well as institutional support during times of crisis.
Who do you think would be best placed to implement those changes?
I think like it is nowadays, that it is still some kind of interdisciplinary support and effort, because one thing is to teach some kind of things, but if we are talking about resources, it's also governmental duty to secure that we have this kind of reserves and readiness to do it. And really to think about, but really on policy change, I would say that educators, because they are the biggest experts. And now we have, this is not any kind of imaginary simulation situation, but now we have seen it actually in real life that it can happen. And we need this kind of knowledge, expertise, and skills also.
Are there any questions that were raised during your research that you think could inform your future work?
I think the question of this kind of revision of curricula, which is important, because to really understand what we are doing now, and are we doing in the difficult and different contexts this work. Because like I said, it is one thing is to have this kind of regular health communication and how to do it. Another way is that we have crisis, we have then emotional burden, mental burden, maybe time pressure, different constraints that force quick decisions, but they also have to be right decisions, or as right as possible. And what we just noticed, which was very regretful, and then this is something to think also in addition to educators and educational system, also on policy level, that what we identified in terms of health inequity was actually the situation in care homes, where we really noticed that due to the fear of the illness and getting infected, the contacts with these ill people were minimized, but actually they might have needed not only this talking and being, but what was said to one of our participants, that even they forbid drinking water because they had to go there. That's why several times to change diapers, for example, but they were not ready. And on the other hand, we need that in these types of viruses, we need to drink a lot of water. So which is totally unethical, that we basically limited the access of this kind of thing that would have helped people to get well quicker maybe. Mm-hmm. But because of the fear to go there and change diapers several times a day, care workers were not ready to go there. And that's why just doing something that at the time, maybe they didn't think that it is so unethical. So maybe these aspects that really to think about also on policy level, that how to support also these people, not only on healthcare professional whose medical knowledge and expertise is anyhow on higher level, but people who are working on care facilities and different dispositions where they are not directly medical personnel, but still they have contact with ill people, and how to support them maybe to understand this mental burden and how to help them maybe to overcome these fears.
Yeah, that's very important. Thank you for sharing that. Do you have any closing remarks you would like to share with our listeners?
Maybe I will share something that we finally didn't submit this article. And it was really, actually it was at some point even frightening what one of our participants said. And when we are thinking about the geopolitical situation today, especially in Europe, one of our participants said that after the different instructions were implemented and different very tough rules were implemented in hospitals, in care homes, she felt first time that we might end up in a situation that I understand now who can come and deport me to another country. And this is very strong statement, because it actually shows that under this kind of situation where there is a lot of fear and a lot of unknown situations and rules that are actually necessary, some kind of humanity might disappear. And this is something that we really have to be aware of, that together with the instructions, still not to lose the humanity.
Wow, wonderful. Thank you so very much, Dr. Lubi, for sharing with us on our podcast today.
Yeah, thank you.
Thanks for listening to the JCIH podcast, Health and Communication Distilled, a podcast of the Journal of Communication in Healthcare, Strategies, Media, and Engagement in Global Health. Follow the journal on Twitter at JCIH Online for news about the articles we publish and other resources. That's JCIH Online on Twitter.